Tonight we're speaking again about optimizing clinical outcomes through at-home patient monitoring, looking at ways that veterinarians can empower pet owners, their clients, to be involved in the care and management of various diseases. With that, we're going to start off by speaking about diabetes, and I'm pleased to pass the baton to my colleague, Dr. Zenger, who's going to lead off our discussion tonight on diabetics, both dogs and cats. Welcome, Doctor.
Yeah, so we're going to start with something a bit low-tech. Urine dipstick monitoring is certainly something that we do in the clinical situation when we're screening for disease, but it's not necessarily in vogue currently, but during the years of my training when blood glucose monitoring was not nearly as popular at home, we did do urine dipstick monitoring, so that's again fallen out of vogue a bit. But in doing our research, Dr. Berger and I came across this Checkup urine dipstick system, and this is not the only one that's out there. So these are marketed to the general public. They're available online. I think we found 4 or 5 of them, and there's other variations of it. But basically, these are designed to be single use. They do provide 2 test strips in case you screw up the first one, but they're designed to be single use. And the dog one comes with this handy little telescoping loop that you put the cup in, makes it easy to collect the sample. And the feline one comes with this non-absorbent sand, so you can soak up the urine. And so these are not necessarily for monitoring diabetics, but this would be something that a client might order off the internet. So we as veterinarians need to be aware that these are available. They cannot replace the keto dipsticks that we're going to talk about because they don't check for ketones. They check for, see on the little strips, there's 4 things: glucose, protein, pH, and blood. And certainly the glucose would be very important. If a client noticed that their dog or cat was urinating excessively, they might order one of these online and check. And if the patient has glucose, then that would prompt them to bring the pet in for a visit. It might also be appropriate for a breeder that has breeds that have problems with kidney disease. It might be an early screening indicator for protein present. We know the urine dipsticks are pretty sensitive in the 80 to 90% range. Unfortunately, there's poor specificity, and so they might have a false positive, but, that's okay. Then that can be followed up at the veterinarian's office. So just to move on to kind of the more meat of the discussion, talking about diabetic monitoring, I firmly believe that all owners of diabetics should have dipsticks on hand, and this would be the keto dipsticks to assess for urine ketones if the pet appears ill. And they should be instructed about that early on in the process, because we certainly know that diabetic ketoacidosis can turn into a real serious medical emergency if not addressed. And so this would be something, if the pet starts to appear ill, that they would check for urine ketones first. And certainly a normal result should not preempt a visit to the veterinarian if the pet, because the pet could be ill for other reasons, could have pancreatitis, other things, but at least if you have that first bit of information, the veterinarian might say, oh, your dog or cat's vomiting and you have positive ketones, just go straight to the emergency room. I don't even want to, see you here. And so that's a nice bit of intervention and really optimizing that relationship that you have with your clients that have diabetic patients. As I mentioned, it was a bit more in vogue to do urine dipstick monitoring instead of glucose monitoring when I was doing my training, and it can certainly be done and for the right owner and the right situation, especially if blood glucose monitoring is a bit problematic. So the urine glucose correlates with the average blood glucose from the last time the bladder was emptied, and so that's really important. So that result does not indicate the blood glucose at that instant. It indicates what happened the last however many hours. And so that's why we typically want to just look at that first morning urine, because that's going to give us an average glucose, presumably from the night before. The patient didn't go out and urinate. And so that gives you a good indication of how good the glucose has been regulated for the last 10 to 12 hours or so. So for well-regulated diabetics, we want that morning glucose to be traced to 1+. If the urine is checked later in the afternoon or early evening before the insulin, that would tend to be negative at that point. And so that would be for a very well-regulated diabetic. And that's where we, obviously want our patients. So there's some general guidelines if you're going to use this, not just to check how well the patient is regulated at home, but also to do some insulin adjustments. And I have actually used this one very notable little Westie that I had that was very, very difficult to regulate. And once the client started doing this, we found that the dog's insulin needs varied a little bit day to day, different activities and that sort of thing. And so the owner was able to really tightly regulate this dog where we actually couldn't do it in a more traditional hospital sense. So for a small dog, and we're just going to arbitrarily say less than 20 pounds, if the urine glucose is negative, we want to decrease the insulin by 1 unit. And for a big dog, we want to make that change by 2 units. And this is very, very arbitrary. Obviously, there's a big difference between 20 pounds and 50 pounds, but you're going to have to use some clinical judgment, how well regulated the patient is before you start doing this and that sort of thing. If the morning glucose is trace or 1+, you don't do anything different. Stay on the same insulin amount. And then if it's 2+, you want to increase that insulin by 1 unit for a small dog and by 2 units for a large dog. There are some published protocols of what to do with 3+ or 4+. I don't feel comfortable making those recommendations here. I think that would have to be done by the individual veterinarian because there are certainly reasons why we might have such high amounts of glucose that are simply beyond needing more insulin, and we'll talk about that. So cats are always a bit problematic in many ways, and certainly using the urine dipsticks for diabetic monitoring for cats very problematic because their urinations are less predictable and controlled. You can take a dog out on a leash and collect the first morning urine. I defy you to be able to time the first morning urine in a cat. And, cats, a lot of times they don't like to be watched. If you're following them into wherever the litter box is, they look at you like, what? Leave me alone, let me do my business. And so then it becomes problematic. So we can't really probably adjust insulins using dipsticks in cats, but luckily we can use the blood glucose monitoring, which we'll talk about later. Some brands of litter may actually cause false positives, and that would be true on both the glucose as well as the ketone test. And so, again, there's protocols out there that you can read about how to collect the urine and dilute it and that sort of thing. I don't do any of those things. If there's a wet spot, you just put the little dipstick right on it, and there's usually enough, even with a clumping litter. If it's been relatively recent, then you'll be able to get enough moisture onto that to cause it. So again, this would be primarily for checking for ketones for cats, not necessarily for looking at how much glucose was there. But if we're going to be having an owner do this, we want to test that specific litter that they're using ahead of time. And so just have them put some, teaspoon of water, whatever, on the litter, and then dab it with the keto diastick and make sure that that particular litter is not going to cause a false positive. So it's really important if clients are doing this that they keep a log. And that's true not only for doing urines, but also for glucoses. I've had too many times where I have a pet that has been in for a DKA episode and sometimes multiple ones, and we're trying to get him better regulated at home to kind of avoid that situation, and they're doing at-home monitoring, and they're trying to make adjustments, and they don't write anything down, and then the pets don't do well, and they say, well, it was high. I don't remember specifically, and so they really, really, really have to keep those logs. And I know sometimes the really good clients are keeping these Excel spreadsheets, and they can get a bit excessive, but certainly better than not having a log and trying to recall things from memory. So this is super, super important. Clients should be instructed to always call the veterinarians if there's positive ketones. If there's wide fluctuations in urine glucose, if they're trace or negative one day and then 4+ the next, that certainly indicates that there's something major going on. That's where those logs can really be super helpful. If there's persistent glucosuria, so if you're never getting to that trace or 1+, if every time they check it's 2+, 3+, 4+, that needs to be addressed. And certainly any time that there's a sign of illness, that client should call the veterinarian directly. My major concern of using the urine glucose monitoring is, we as veterinarians all know what SMOGI is, but basically if the pet becomes hypoglycemic, and even if they're not clinical for it, perhaps that blood glucose is dropping in the 55, 60 range, and their stress hormones just suddenly go, wah! Here comes all the cortisol and all the other hormones that make that blood sugar just spike right back up because it's a protective mechanism. The next 2 to 3 days, they're going to show a lot of spillover, and they're going to be in that 3 to 4+ range on the urine, and that would normally indicate a higher need for insulin, but in this situation it actually indicates a lower need. And so that can create a pretty bad situation, which again is why if they're continuing to increase the insulin based on those urines, we don't want to get into that situation. They do need to come into the veterinarian to have some form of in-hospital monitoring. So we'll talk a little bit about higher tech, blood glucose monitoring. I think veterinarians of this day and age are much more used to that. I think it's being pushed quite aggressively in most veterinary schools at this point. So we all know that regular glucose monitoring is essential for successful regulation of diabetics, absolutely essential. In-clinic monitoring is stressful, and it is very unlikely that it represents the home environment. Dogs, I think the blood glucose curves are a bit more valid, but I never do tight regulation based on the blood glucose curves in hospital alone. The other thing that, we're always worried about is the cost. We have to, as veterinarians, worry about that. I have very, very few clients that have unlimited funds. So at-home monitoring saves the pet owner time and money, and so that makes everybody happy and continues to foster that bond that we have with our clients. The available human glucometers are not valid for use. We certainly used to use the one-touches, really, realizing that they weren't the most accurate, but we don't want the client to go to Walgreens and purchase a one-touch. We want them to get one of the ones that are validated for use in dogs and cats. So most of us veterinarians are familiar with the AlphaTrack and the upgrade AlphaTrack 2. So these are intended for either use in the veterinary hospital or at home use, and AlphaTrack does recommend this is something that is actually used at home. They do want this to be by prescription, although there are workarounds. The client can't go to the AlphaTrack website and purchase this. I think they can if they have a prescription, but they can't just as a client. But there are ways to get things through the internet. That's not the ideal situation because we do want the client to come in and actually train them as far as how to use the AlphaTrack. It's very user-friendly. There is an instructional video, and there's also tracking software. So it's really nice that they can actually bring in the printouts of what's been going on. So that kind of gets away from having to keep those logs. Although these are validated for dogs and cats, they're not as accurate as we would like. There was a recent publication that showed that the blood glucose can either be higher or lower of what you see on the AlphaTrack readout, depending on the packed cell volume of the patient. And this publication actually developed a correction formula so you could accurately convert that. So if you know the patient's packed cell volume, you apply this calculation, and then you know the true blood glucose. So for dogs, it could be either higher or lower. For cats, the reported blood glucose that you see on the little machine, say it says 90, it's going to be lower than that. It's something less than that, and depending on what the cat's PCV is, it could be substantially lower or not a lot lower. I tried this out in our hospital on some cat samples, and the correction formula does not work in the cat. So we don't know at this point how off it's going to be, and so if you have a low reading on a cat, assume that it's actually lower, and potentially if they're in the hospital, check it on the serum chemistry analyzer. If the client is reporting something in the low end of normal, like a 70, it's probably time for them to be giving some Karo syrup or potentially bringing them into the hospital. So I mentioned that this was a recent publication. We actually did an evidence-based update. I direct you to that. So the correction formula for point-of-care glucometer values in dogs. What we did in our hospital was we just laminated a little piece of paper that had the formula on it, and so you can actually, if you know the dog's PCV, you can actually just convert and get the actual blood glucose value rather than what's being displayed on the AlphaTrack. So when we were at Western States, we visited a lot of booths, and we stumbled across this Kill Paw. Neither one of us had heard of this. It's brand new. The rep didn't know much about it. He didn't have any literature for us to read about or anything like that. It is, again, for dogs and cats. This is being marketed to the general public, so the client can actually go to the Kill Paw website and just order this. I would encourage, if a client does this, that they do bring the glucometer and the pet into the veterinarian and validate a couple of blood glucoses and see how it runs, because right now we don't have any data. Of course, that's probably going to invalidate the difference in cost, by having that veterinary visit, but at least we want to know that what the numbers are, if they're even close. This is a spin-off product from the human market, so at this point we don't know how valid the results are going to be.